Hello, everyone, and welcome to episode 9 of the second season of Right in Front of My Face, the podcast talking about big things happening right in front of us. The last few episodes of the show have been very socially aware, dealing with big issues and the ordinary people doing amazing things to tackle them. This episode veers from that theme slightly, but the topic is something near and dear to my 42-year-old heart and something many of us are dealing with but never ever talk about. Drumroll, please. Menopause. See? Did even the word scare you? Did the mere mention of a woman's menstrual cycle make you uncomfortable? I admit it, me too. The truth is, I didn't ever learn about my cycle, like really learn about the mechanics of it and how it all works until I wanted a baby. And then when I sat with the book, Taking Charge of Your Fertility, and learned about temperature changes, weekly symptoms, and why the changes happen, my mind blew. I reeled with how ignorant I'd been about my own body and how if I had a daughter, our amazing cycle would be a part of our conversation. So, armed with my new education, I had 2 babies, nursed them both, and figured my hormones could be put on the back burner for a little bit now that I was done. Boy, was I wrong. About a year ago, my hair started falling out. Now, for those of you that have seen pictures of me, I have a lot of hair. So initially when I started shedding, I didn't really think too much of it. But then I started bleeding and didn't stop for about 3 months. And then COVID hit. It was pretty easy to ignore the symptoms, especially when you can't get into a doctor. But I started mentioning it to some of my close girlfriends, and one in particular was like, "Congratulations, this is perimenopause." And I literally had to look up what that word meant. Here I was, again, a fully college-educated woman, completely clueless about my own body and what it was going through. The last few months have been one of discovery for me regarding the latest and greatest phase of my life, and I'm not going to apologize for TMI. This information is not, in fact, too much. It's information that more women need. We need to empower ourselves with knowledge about our own bodies and what happens once we pass the first half of our childbearing life. There's such a sense of shame surrounding the female cycle. I feel it even as I'm sitting here talking about my own body, which has served me well. This is a topic we as women need to not be so shy about because it's confusing, it can last a really long time, and you can absolutely feel like you are losing your mind. We will all go through this. 50% of the population is female. It's time we talk about our cycles without shame. So the same friend who welcomed me into perimenopause referred me to an incredible clinic called Gennev. Genev's entire mission is to educate women about menopause and give us the tools to succeed and thrive in our new phase of life. Genev's chief medical officer and director of Swedish Hospital's Menopause Clinic, Dr. Rebecca Dunsmoor-Su, generously gave me an hour of her time to help educate us all and welcome us into our next phase. Ladies and gentlemen, let's talk about menopause with a real life expert. I'm here with Dr. Rebecca Dunsmoor-Su. You have a lot of titles. You're the
I do.
You have a lot of titles. I think I always feel a little bit nervous when I'm talking to people that I know are really studied and smart, and just given your title list, which I will rattle off, it is a little intimidating. Dr. Dunsmoor-Su is the medical director for Menopause at Swedish. She is a chief medical officer at Gennev. And now this just says your LinkedIn, but you're a partner at OB Best Practice. Is that still?
That is true. That is actually just a small company I own with a colleague. We write educational and online textbook for other OBGYNs.
Well, it's quite a list of titles. You are clearly a leader in the field in our area. And I found you through the company that you're CMO for, Gennev.
Yes.
One of my good friends and I were kind of chatting about some symptoms that we were both experiencing. And she said, you have to have an appointment at this clinic with this doctor. She's amazing. She gave me a plan. And it was so helpful to her that that's how I ended up booking my own appointment with you.
Yeah.
Dr. Dunsmoor-Su, will you take us through just a little bit of your background, talk about where you're from, where you went to school, all those kind of little tidbits before we get into this?
I am happy to. So I did my undergraduate degree at a small women's college called Bryn Mawr College, just outside of Philadelphia. And then I did my medical degree and my residency in OBGYN at the University of Pennsylvania in Philadelphia.
Did you always know that you wanted to specialize in OBGYN or?
No, I didn't even know I wanted to be a doctor. Actually, my undergraduate degree is in physical anthropology and evolutionary studies.
Really?
Yes. And then I sort of decided after college to go back and apply to med school. So I actually did a year, what we call a post-bac year, so a post-baccalaureate year, where I took all the sort of pre-med requirements in 1 year and then applied to med school.
That's really interesting. And you just blew through your OChem and your bio and everything?
Yep.
Just pack that all into 1 year.
It was an intense year.
It must have been really fun.
Yeah. It was an intense year with an intense group of people because there were about 50 of us doing it all together. Yeah.
Wow.
I also, while I was at the University of Pennsylvania doing my medical degree, I did a combined degree. So I did it in 5 years. I also did a master's degree in epidemiology and biostatistics, which is sort of clinical research focused.
What a time to be alive. You can use that degree right now.
Oh, yeah. It's definitely come in handy when explaining studies to people.
Yeah. So how did you get on the OBGYN track?
So when I was in med school, I definitely fell in love with OBGYN. Now, I went to women's college, big feminist hotbed. I was always a huge feminist and did a lot of work with Planned Parenthood and access to care for women. So probably anyone who knew me would have known I would go down this pathway. But really, it was the combination of somewhat continuity of care with a surgical relationship and procedural stuff. OBGYN just sort of offered me everything in one package. Like, I love being in the operating room. I love fixing things with my hands, which, you get to do in surgery or in a delivery. But I also like having that ongoing relationship with women.
How did you find Gennev? So you practiced as an OBGYN for quite a while, correct?
Mm-hmm. Yeah. So I moved out to Seattle in 2005 and was faculty at University of Washington for about 7 to 8 years. And then I transitioned over to Swedish in a inpatient sort of emergency role. So I just did inpatient emergency care for OBGYN.
Okay.
And while I was doing that, I built a small menopause practice because I just missed menopause. Menopause was something that was always interesting to me and something I really loved. It's sort of the endocrinology of it. And then Swedish sort of approached me and said, hey, we're building out a whole center for menopause. Will you sell your practice to us and come be our medical director for menopause? At the same time, I met Jill and Shannon at Gennev, they were a fairly small operation at the time because we were doing informational and educational pieces together. And I just kept working with them. And as they built into much more of a startup company, I came on as their chief medical officer.
Gennev is such a unique company, and your practice and your niche is so unique also. I will say I'm actually really looking forward to our chat because I really don't know the first thing about menopause. And it's interesting that you say your background and being a feminist. I really am kind of late to the game on this, but I feel like we don't talk about it. We don't talk about our cycles. We don't talk about anything that has to do with periods or stopping periods or phases.
Nope.
And then all of a sudden, like, I had 2 babies. My youngest is 5. I think I'm going to be able to be on cruise control for a while after the peaks and valleys of childbirth and postpartum, then getting pregnant again, then postpartum. No, it was not. I crashed into this next phase of life faster than I ever thought possible. And we don't talk about it.
We really don't. And I think we do women in this country a huge disservice because we just don't educate them about their bodies. We as women don't understand how our ovaries work and what they're doing.
No. When I went to get pregnant with my first child, I remember reading this book about, I cannot come up with the name of it right now, but learning about my own cycle. And I was like, I am 30 years old and I never knew any of this stuff ever.
So much shame and fear has been attached to the female cycle, when in fact, it's a really beautiful and amazing process. We should be celebrating it, not hiding it.
Agreed. Especially this next phase. What I love about Gennev's mission is to empower women to take control of their health in the second half of life, starting with menopause. Talk to me a little bit about when women can start this perimenopause phase. So I will use myself as an example. I will put myself out there. I am 42 years old. And about a year ago, I started experiencing some irregularities with my cycle that I never expected. And I had no idea that my hormonal changes could happen kind of this early in midlife. Is that normal?
It's on the early end of normal, but it's absolutely normal. And the perimenopause is sort of a vague time. Perimenopause is that time where things get a little bit more irregular. You're heading towards menopause, but you still have cycles. For some women, it's a really brief period. They have a year of intense symptoms and they're done. And for some women, it's 10 years long. And, everybody's body is just so very different that we can see these variations. And some of it's variation in actual hormone levels and how their body behaves. Some of it's just variation in how in tune you are with your body. Some women just don't notice these things and some women do.
We'll be back in a moment with Dr. Rebecca Dunsmoor-Su. I am so excited to welcome the second sponsor for Right in Front of My Face Season 2, Tracy Erickson from Compass Real Estate. Tracy, there are, I don't know the exact number, but there are a lot of real estate agents in the world. And I would like you to tell people about why they should choose you.
Well, I would say I'm a market expert. I truly do understand what it takes to sell a home for the highest price. And of course, I understand for my buyers what it takes to compete in this crazy Seattle market.
Which is not easy.
No. But really, when it comes down to it, I'm a relationship person. I've worked really hard to build relationships with different agents and other realtors in the Seattle area. And I feel like that goes a really long way when one of my clients is making an offer on, another agent's listing, or they're making an offer on one of my clients' listings. I make it a priority to play nice in the sandbox. And that goes a long way.
I can relate because my priority in the interviews that I find and the stories that I'm helping tell, I tend to listen more than I talk.
Yeah.
How does that fit in with your philosophy as an agent?
Well, I just think that's a life lesson, but
I'm still learning.
Oh gosh. Well, I treat all of my clients like they're friends or family. This just isn't a transaction to me. This is a relationship. And when the transaction ends, our relationship doesn't. For most people, this is the biggest transaction of their life, and they're going to experience every range of emotion, from excited to stressed to happy to sad. And I am there with them every step of the way.
Tracy, I appreciate your philosophy and your outlook and your authenticity. And thank you very much for your support of Right in Front of My Face.
Yeah.
Tell people where they can find you.
Well, my phone number is 206-251-6351. You can also jump onto the Compass website, compass.com, and type my name in, Tracy Erickson, and find me there. Or you can follow me on Instagram at Tracy Erickson Homes.
And I would highly recommend that area because her stories are wonderful.
Thank you.
Welcome back to a chat about menopause with Genev's Dr. Dunsmoor-Su. So I guess to take it back to a more elementary level, can you walk me through what menopause means?
Absolutely. Menopause technically means cessation of menses, so end of periods. And really, we define that as a day. It's the day 12 months from your last period. You've gone a full year without your period. You are now in menopause. And it's defined that way because we defined it when we had to work with outward signs, right? That was our outward sign of this transition, was the bleeding that a woman had each month. So that's technically what menopause is. Now, leading up to that, your ovarian hormones are sort of all over the place for a variety of reasons. And, all of this has to do with the fertility cycle. All of this has to do with how your ovaries work fundamentally to release eggs and get you pregnant. And once you go through the menopause, they no longer do that thing. They've stopped releasing eggs. The eggs are gone.
There's so much finality to that. It really is crazy because I look at my daughter and she's 5 years old and I know that she will be going on this journey as a woman. It really is crazy to think that like one day it will stop.
Yeah. And what's really amazing is if you really understand embryology, like when a female child is in utero, they have millions of eggs. And by the time they're born, it's on the range of tens of thousands of eggs. And by the time they hit puberty, really only about 300 to 500 of their eggs will ever actually make it to a functional status. So there's a lot of attrition in these eggs in the ovary.
It's frankly amazing to me. And I remember going through this when I was trying to get pregnant. It's amazing to me anyone ever gets pregnant. It really is such a miracle of timing.
I think all OBGYNs go through that process when we realize just how complicated it is to put an egg and a sperm together and have all the genes line up exactly right.
Yeah, it really, it's staggering when you really break it down. Mm-hmm. So a lot of middle-aged women I know, and this can be even age 35 and up, we wait longer to get pregnant now. When more and more women have gone to college, had careers, that age just gets extended. I have had girlfriends who are 35 and said, okay, it's time for me to have my second. I did that. I waited till I was 35. And it's so much harder to get pregnant. And we just don't always realize, even though the norm is to get pregnant older, what we are fighting from a hormone perspective.
Right.
When we start that late.
It's not even necessarily the hormones themselves. It really all goes back to the eggs and how they age. And I think you said something really important. You said it's sort of the norm to get pregnant later, but it's not biologically the norm.
Right.
It's socially our norm. And it makes perfect sense with the level of education and the complexity of our society. Unfortunately, our bodies as women haven't really followed along. They still pretty much have the same cycle that they always have. And so from a biological perspective, your teen years are a great time to get pregnant. Doesn't mean I want teenagers getting pregnant. Exactly. I'm just saying that's biologically how we're designed.
Now, I want to talk a little bit about what brought me to Gennev, because I'm hoping that women out there will hear this and kind of realize that they are not going completely insane. But I had my daughter, like I said, 5 years ago. In about the last year, I had noticed I have an IUD, an intrauterine device, and it's been great. And I really haven't had a cycle with my IUD in place. But about a year ago, I did start getting a cycle. It started getting more heavy. It wouldn't stop. And I started getting symptoms like I had gotten when I was a teenager. Talk to me if that is like a recognizable thing. I mean, my PMS got horrible. My anxiety kind of went through the roof cyclically. And I think those are the beginning symptoms that we don't even recognize our bodies actually changing.
Right. They really are the earliest symptoms. And we often don't recognize it either because we have an IUD, because that's a great birth control method, or because our cycle still may look actually relatively normal during the earliest parts of perimenopause. What's really happening behind the scenes are that, when you're young, your ovaries make a spike of estrogen in the beginning of your cycle and a spike of progesterone in the second half of your cycle. And that's how the estrogen promotes an egg to release, and the progesterone stabilizes the lining of the uterus to implant a pregnancy. And then if there's no pregnancy, then it goes down and you bleed. And those curves are very nice and even every month for the most part early on when your ovaries are young. As you get into perimenopause, not every egg is as good as the next one. So some months you might recruit an egg, but it's not looking so good. So the estrogen never actually gets all that high, or the estrogen gets too high.
Your body just stops getting excited about it.
Well, no, what happens is, so if an egg is not really recruiting the way it should, your body will shoot the estrogen really high to try to push that egg to ovulate.
Okay.
If, say, you recruit one egg and it's not very good, but then you recruit a second and suddenly you have two eggs, then the estrogen will go down because you have this, it's all a feedback loop between your brain and your ovary. What I'm trying to say is you never really know on any given month what that hormone profile is going to look like. It's all over the place. So some months really high estrogen, some months really low estrogen. Some months you get a really big spike of progesterone. Sometimes that progesterone spike will last a month and a half because you never actually released an egg, so it just never goes away. It's sort of the wild west of hormones. And that's why you get that sense of, that's why PMS tends to get worse. Anxiety, depression, those things start to show up because the brain is very hormonally sensitive. There are estrogen and progesterone receptors all over the brain, including in the centers that control mood. And they can cope for the most part with a predictable and even amount of hormone. But if they never know what they're going to get month to month, then symptoms tend to be very varied month to month. You can sort of see how that would happen.
It's really interesting because until I started realizing how much my anxiety was ratcheting up the week before my period, but it's so irregular, it's hard to tell. But it was very real. It is very real.
It is absolutely real. And, I want to make a really important point, which is I separate that from women just being hormonal. Hormones impact your brain. We're designed that way. Men's hormones impact their brain just as much as women's. It's just the way we function. I'm not saying that, it's just your hormones, suck it up. What I'm saying is you have to understand your hormones. They're changing. And so you're going to feel and sense that change. And it's not something to be ashamed of or to hide. It's something that we can manage because we know what's going on.
I think that is such an amazing point because I was and am still feel a little crazy. And you kind of go about your life and these peaks and valleys. It's easy to think that it's really in your head and that you are going crazy. But I think the hormonal spikes are super real. And like I said, I know so many women who just experience anxiety on their good days, knowing that this might be something else, I think could be really helpful.
Yeah. And it doesn't actually mean you have to do anything about it. For some women, just understanding what is going on is enough information that they can manage it. And for some women, they need something done. Every woman is different. Every woman is different in her experience of the perimenopause, and every woman is different in how much medication and or treatment she needs.
That was a wonderful segue. Thank you. Let's talk about treatments because I know there are a lot of us out there that have some questions about estrogen. Should we be worried starting it that early? What are the options for the legions of our sisters that are going to experience this if they are not already?
Right. So in the perimenopause, so in the time where you're still having cycles, they're maybe getting irregular and the hormones are sort of all over the place. The easiest thing for us as physicians to do is sort of take over and manage those hormones so that you lose the spikes. And what I mean by that is really sort of take control of your menstrual cycle. And the easiest way to do that is birth control pills, simply because they're strong enough to override the ovaries and tell them to be quiet and stay out of it. And they give a nice even dose of hormone all the time, which is sort of what we're aiming for in terms of managing some of those symptoms like anxiety. For most women, that's actually a very safe thing to do in this transitional time. There are exceptions. We tend not to use birth control pills in women over the age of 35 who are smokers. If you have high blood pressure, you might not be a good candidate. And if you've had a blood clot, you're not going to be a good candidate, or you have a high risk of blood clotting. But in general, it's actually a really safe and easy and effective way to take over sort of the hormonal milieu for this time. And what we typically do is just sort of have you ride those birth control pills into your early 50s, and then either you can come off and see if you're in menopause, or if you come off and there are a lot of symptoms and you want to go back on, then we tend to step down onto what we consider a lower dose or hormone replacement dosing of estrogen and progesterone. Also, for women who, for whatever reason, cannot take hormones or don't want to take hormones. And let me just say up front that I love hormones. I think they're great. I'm an OBGYN. I think hormones are the bomb. And in general, they are very, very safe and probably the most natural way to cope with this. But for some women, they're not a safe choice. And then, we look at, okay, so what are your symptoms and how can we manage those symptoms? So it's really the question of, do we treat the underlying changes or do we treat the symptoms themselves? And there's certainly lots of medications that can be used for anxiety and depression and some of these other symptoms, even heavy periods.
I feel like I've heard a lot of chatter about not wanting to be on estrogen for a long amount of time. Now for me, I haven't. Like I said, I've had an IUD. So for me to start estrogen, is there really any concern about being on estrogen for a long period of time?
That's a really good question.
Thank you.
And the answer is no. Probably it's actually very safe. Because if you think about it, let me reframe it. We've all, as women, been on estrogen since our period started, right?
Right.
We all have estrogen every month. This is a natural hormone. It's what we have every month that helps us to cycle. So no, just being on estrogen over the course of your reproductive life is totally normal and a safe thing to be. The question then becomes, well, what about with these replacement doses or these replacement forms of estrogen? Are there different risks? In terms of birth control pills, really, no. If you're still in that sort of reproductive age, there's not a lot of increased risk taking hormones through that time. We then have to get into the discussion of, well, what about after the menopause and hormone replacement? Because that's where I think a lot of the fear comes in.
100%.
There's been a lot of fear mongering about that time of a woman's life. And I think there are two really important points. One is that even in the Women's Health Initiative, which is that big study that came out in the early thousands that said, oh my gosh, we had to stop the study because there's a higher rate of breast cancer in these patients. That was in patients on estrogen and progesterone. They never, ever showed an increased risk of breast cancer with estrogen alone. And I think we have years and years and years of studies that tell us that estrogen really doesn't cause breast cancer. And I know that's going to sound crazy because everybody says it does, but it really doesn't. Estrogen alone does not cause breast cancer. The question really comes with the progesterone arm. And that's a little bit of a more complicated story because there are lots of different progestins that you can encounter. The progestin that showed an increased risk in the Women's Health Initiative is something called medroxyprogesterone acetate, or MPA, and that was the most common form used for hormone replacement for many, many years. It is not the most common form used now by most physicians. Even if you use that form, which showed that slight increased risk, it really was a slight increased risk. It increased the risk on average about 1 per 1,000 women years of breast cancer, which is sort of a weird way to express things, but it's sort of how we do it in research. We look per 1,000 woman years.
What does that term mean, per 1,000 woman years?
So per 1,000 years of a woman being alive. So obviously we haven't watched one woman live for 1,000 years. Right. So we combine all the women together and we say over 1,000 years of lifetime here, there'll be one more case of breast cancer.
Wow.
We don't really use medroxyprogesterone acetate that much anymore. I do use it in some patients. Some patients just do better on it. But most of us are using what's called micronized progesterone now, which is what is sometimes called bioidentical. And that's a whole separate conversation we're going to have.
Okay.
It looks like the progesterone that your ovary used to make is basically what that's meant to mean. And I tend to like to use the term body identical. That comes from the UK, where they've had the same struggles we have with compounding and such. And so they have coined the term body identical for estradiol and micronized progesterone, which are the regulated hormones that we have. And studies out of France and other small sort of pathology studies seem to indicate that it really doesn't increase the risk of breast cancer. Can I say for sure 100% there's no risk? No. But I think the risk is likely quite small from taking hormone replacement.
And it seems like the benefit, the cost benefit analysis on that, I think a lot of women are willing to take.
Right. And that's really you've hit upon the most key thing. You need to look at the risk benefit analysis for you. It doesn't matter what it is for me. It only matters what it is for you. If you have a ton of fear of breast cancer, then maybe it isn't a good risk for you to take. However, what I tell patients is, 1 in 8 women are going to get breast cancer. The best thing you can do to minimize the risk of breast cancer is get your mammograms and get your breast exams and make sure you stay on top of it. Because if we catch it early, you're going to survive breast cancer. 95% of women do. So we just need to reframe the discussion because hormones can have a huge benefit for women. They can feel a whole lot better.
And if you're over the age of, 70 and you're on a hormone supplement that's been working for you, again, to that cost benefit, if it has progesterone in it, I mean, you're just kind of saying like...
I do not... If I have many, many patients in my practice who are well over 70 who are still on their hormones because we have that discussion and they say, it is giving me quality of life. And I say, okay, As long as you understand these are the risks, these are the benefits, where do you fall in that? And they can say back to me, I understand the risks, I want to continue. I'm more than happy to continue with them. It's all about risk-benefit ratio. And it's really not about breast cancer at 70. What I'm talking to them about then is stroke and cardiovascular disease.
There's just no free pass.
That's really what kills women.
That's interesting.
Breast cancer doesn't kill us. There's an interesting book I highly recommend to people to read if you really want to understand estrogen and how it works in the body and the whole debate and all the research on it. It's called Estrogen Matters. The authors are Dr. Avram Blooming and Dr. Carol Tavris. And Avram is a oncologist. Carol is a psychologist. And they talk both about the research that's been done and how it's been communicated. But one point that they make, which I think is a brilliant point, is that more women with breast cancer will survive their breast cancer to go on and die of a heart attack than will die of breast cancer.
And that's another thing we don't talk about.
Yeah. Heart attack is the number one killer of women.
So talk to me a little bit about the amount of research that there is on menopause.
There is research on menopause. What I would say is there's a difference between research on menopause and good research on menopause. And some of it's just we learn over time. We ask questions one way and we go, oh, I totally should have asked it this other way. I'll have to go back and do it again. That's a normal process in scientific research. We learn every time we do a study, we learn something new and we reframe the next study better. But a lot of the research that was done early on in menopause isn't necessarily applicable anymore because they were using hormone doses and hormones that we no longer use.
Well, I was thinking that actually as you were describing the last hormone study where you're like, yeah, the paper came out in the early 2000s, but hopefully things have changed in the last 20
and
years.
There are many papers that have come out since then that have looked at things in different ways. But you have to remember, when we're looking at some of these risks like cardiovascular disease or breast cancer or anything like this, it takes 10, 20, 30 years for these outcomes to come about. So by the time a paper publishes, we've moved on 30 years in how we use hormones. It's a hard thing to study well because they're not short-term outcomes.
No, and they continually change.
Right. They do.
I think that's the most interesting thing is that it's this constant ebb and flow. And it's hard to, even if you, like I got my hormone levels tested and even you were like, well, these don't really matter because they could be different tomorrow. And so.
Exactly.
So it doesn't, they don't even paint the picture.
And I was actually just having that conversation with the head of Gennev. We were just talking about hormone levels and why, there's this myth out there that we can do a test and tell you where you are in menopause. We really can't because the whole perimenopausal time, your hormones are all over the place and different month to month and week to week. And some of that's just normal transition through the cycle, but some of that's also just perimenopause. It's very irregular. And we have studies that have told us that.
So then how do you know? I mean, really, is it just you sort of gauge your symptoms and you're like, well?
Yeah. I'll posit to you two ways. One is I don't necessarily need to know exactly where you are because if you're symptomatic, I need to help you and treat you for what those symptoms are. The second thing is once you've not had a period for 12 months, you're all the way through menopause.
Right.
And that's really the only marker we have. I mean, we can describe how perimenopause tends to progress, but every woman's different. Again, most women have their cycles will get a little bit closer together first, and then they'll start to space out or skip, and then they'll go for the full 12 months. But some women have normal periods until their very last one, and then they're in menopause. Every woman's just a little bit different.
We'll be right back after a word from our sponsors. I am sitting here with John Gruss from Element Mortgage. Talk to me about mortgages.
Yes, crazy. It is an absolutely crazy market out there. If you've been paying attention to anything in the news, you've heard that interest rates are at historically low levels. That is true. Fannie Mae, Freddie Mac, the two major government entities, have reported that the interest rates currently are at the lowest level they have ever seen. So it's definitely an exciting time in the industry right now for us.
So I've owned a house for 16 years and I still don't fully understand the mortgage business.
Not something you do every day. That's okay.
It's not. So tell me a little bit about where you're licensed to do business and who can get in touch with you.
Absolutely. We're actually licensed in 48 states through our parent company, which is American Pacific Mortgage. Our brand, Element Mortgage, we have 4 locations based in Washington, California, Colorado, and Hawaii. So in terms of working directly with us, that's our footprint. But if you're in any of the other 48 states, we have the ability to assist.
So the line that always gets me is whatever you've got, we've got you. Tell me a little bit about the philosophy behind Element Mortgage.
Really, it's about focusing on the consumer and their needs and providing options. You hear about refinancing right now. Well, what does that mean? Should I refinance? I'm already maybe a few years into my loan. Does it make sense? With where interest rates are today, it absolutely is worth it to explore your options. And that's what we provide. We provide an expert element. That's part of our business. We're local, so we know what's going on in the local market area. And again, as you mentioned, the human element. It's a major part of this. Again, you don't buy or refinance a home very often. So it is important to have a team that's behind you that you can trust when going through a major transaction like this.
Thank you so much for your support of Right in Front of My Face.
My pleasure.
And if anybody needs John, his information will be up in the show notes. And how do they get in touch with you, John?
Easy. Give me a call, 206-954-4787, or hit our website, elementmortgage.com. John Bruce, NMLS number 1108421. Element Mortgage is a division of American Pacific Mortgage, NMLS number 1850, equal housing opportunity.
Welcome back to Right in Front of My Face. What's your advice then for how we educate women about this? Because in my experience, I had my second baby. You're seeing your OBGYN on such a regular basis. You've got a relationship. Right. Then you have the baby. You go in for your annual exams. But you don't have those same touch points. And I don't think a lot of general practitioners, if you present with anxiety, if you present with like, man, I am sweating at night, that they're not necessarily going to say, well, maybe you've hit perimenopause. What are the touch points where we can educate women who are done having babies about what is going on and maybe what to look out for?
Well, I think that's one of the key things we do at Gennev. It's just educate, educate, educate. That's part of our mission. And all the education on that website is absolutely free. I mean, we have all sorts of things just to understand how your body works and what menopause can look like for different women. I think it's to a certain extent up to women to educate themselves. We don't do a good job in terms of if I had my druthers, we'd be teaching this in sex ed. When we teach girls that they're going to get their period, we also teach them that it's going to end and what the other end looks like.
And I don't know if you think this is true, but I feel like, with my mom's generation, they just didn't talk about it. There was so much shame attached to it.
There was shame attached to menstruating in general, but also aging in our society is not respected. And you don't want to admit you're aging. And menopause is a sign of aging. I think as women become stronger and more capable and more independent, it's become less of an issue because you know what? We're out there and we're happy at 50 and we're happy at 60 and we're in the best part of our lives where we have the ability to do the things that we want to do. And so I think aging to a certain extent has destigmatized in that sense. We still have a lot of stigma in this country around aging though. So that's something we really need to overcome. We need to stop seeing aging women as not valuable anymore.
I could not agree more with that, especially as, like I said, having my own daughter now and thinking about how I want her to look at her own body and not feel ashamed by it and be able to talk about it. And more importantly, as she does think about having babies, talking about how the whole thing works.
Right. Understanding how it works so she can make choices that make sense for her. Just because you understand how it works doesn't mean you're going to choose to have babies at 14.
Correct.
Yes. you deserve the power of your own body.
Well, I think the biology,
how it works.
Exactly. The biology is fascinating.
And biology has no value. It's not a moral or social value. It just is. That's the way our bodies work.
Yeah. And it's a pretty incredible process. I mean, I really didn't know that your core temperature changed until I started tracking my own ovulation. I mean, it was this really like awakening for me where I felt like as a teenager, I might have felt more empowered.
Right.
Had I known how powerful this cycle is.
Right. But so much religion and morality gets wrapped up into women's bodies where it really just shouldn't. It's not morality. It just is. It's a physical, your body does certain things. That's how it's physically designed. And if you understand it, then you have the power over it. And I think, well, sadly, to a certain extent, that's why it's been hidden from women.
Well, and now we're living longer. So you're sort of like, okay, well, the next 40 years, we're really going to have to get ahead of this.
And, really, that's my goal in all the work I do. Menopause is a time point. Menopause is a transition that is, important to women and can be really difficult to manage. But really what I'm thinking about is this woman's got 30 more years of life. What is the healthiest pathway I can set her on so that she gets to enjoy all 30 of those years or 40 of those years?
Yeah.
Or 50, who knows?
I don't think I know. I don't really think I know anything anymore, honestly. Yeah. But I feel like there are things that you can do to exactly what Gennev is trying to do is empower yourself with information and knowledge. So tell me a little bit about the team of people that supports women going through this transition, because it's not
happy to, because I'm really proud.
Yeah. And it's not just hormones. I mean, and anybody that's going through this, I will say anybody that's going through this, it is normal to sweat through your sheets at night. It is normal to have no idea why. It's normal to have kind of the ups and downs.
It is both normal and you don't have to live with it.
Yeah.
We've really built a platform where all the options are available to a woman. And the reason we've done that is different choices for different women. Different women have different risk factors. They have different benefits from different therapies. And so they need to have something that they can choose that makes sense for them. So yes, we have telehealth services. You can see an OBGYN who is practiced and knowledgeable about hormone replacement therapy and other medications that can be used through our telehealth service. And, we're in 50 states for that. We are available. But that's only one arm of what we do. Probably the biggest arm of what we do is actually helping women develop a lifestyle for managing their menopause and their health long term. So we have something called it's a membership program. It's called Health Fix, which is health coaches who we've trained specifically in menopause and the changes in the physiology of menopause. They're all registered dietitians. Many of them are also exercise physiologists. And what they do is they work with women one-on-one, both via phone calls and texting and accountability, to develop a lifestyle plan that makes sense for them, both to manage their symptoms, whether it be sleep symptoms or weight symptoms or other health outcomes or goals, but also to manage their anxiety, to manage their stress, to keep them accountable to living their best life and actually taking care of themselves, because we as women tend not to take care of ourselves. We take care of everybody else first. And they sort of work in conjunction with the physicians. So if anything pops up when they're working with a woman, they're like, I think you need to see a doctor. We're right there. But it's really about just designing your lifestyle. And then the third arm of the sort of tripod of Gennev is products. So we have supplements and other products that are made with good manufacturing processes and are verified. So we have like a black cohosh for someone who's having some hot flashes but doesn't feel like she needs hormones. You can try an herbal. We have some CBD for sleep. We have a really great vitamin pack called Vitality that sort of focuses on the nutrients that women over the age of 40 really need. We have lubes and we have washes and all sorts of stuff there that you can sort of explore, all really designed with the woman over 40 in mind.
And I mean, that is one thing that we haven't touched on is, painful sex is a part of this phase also. And that can be really jarring.
It can be really jarring, and there's sort of a stepwise fashion that we as gynecologists really walk through with women, but you should not continue to have painful sex because you will over time cause more problem in terms of pelvic floor tension and things like that. So between moisturizers and lubricants, possibly some vaginal estrogen, there are other therapies that are out there, we can absolutely manage painful sex, and that should not be something that women are having.
I think what is for me the most powerful, I mean, just with the talk about menopause in general, is that women do not have to suffer through this phase of life with no help.
Absolutely not.
And I think so many of us are afraid to talk about it. We're afraid to talk about it with our friends. It's taboo. Like, I don't know anybody who's going to be like, man, my vagina is super dry. I mean, it's just this, it's just like not a topic that comes up very often, but it is real. These insane mood swings are real. The hot flashes are real. And
it's all real.
And it's all real. And especially with, you know, my first conversation with you as, you know, doctor patient, it was saying like, you don't have to suffer through this. Like, we can help you. This is manageable. And I think even that tiny window of hope helps you manage your own symptoms better.
Absolutely. And what I tell people is, you know, Gennev's a great resource for finding those physicians who understand menopause, but it's not the right resource for everybody. The other place you can look is the North American Menopause Society, which is sort of our national body that studies and promotes menopause education. They maintain a list of what they call NAMS certified menopause practitioners. That's the last bit of letters on the end of my degrees, which is NCMP. And that means that we've done some additional medical education. We've taken a test. We've proven that we actually understand menopause. And so you can look for an NCMP practitioner on their website as well. You know, like I said, Gennev's in 50 states. We're there, but we don't take insurance at this point in time. We're a cash service. So if that doesn't work for you, also look on the NAMS website and see if you can find someone in your region or neighborhood who might understand menopause and be there for you.
Can you speak to the efficacy of acupuncture? Because I know that is one thing that is recommended. What has your experience with that been?
I'll give you what I know from the research and what my experience is. So the research is tough because acupuncture is something that's hard to research from a Western medical perspective. We like to see randomized controlled trials, but there's some question about, well, even if you do sham acupuncture, isn't that really just acupuncture? Couldn't that have some impact? So I'll say that the studies are mixed.
Really interesting.
Yeah. Studies are mixed, although they do tend to show some benefit. I think it's with a 6-week course of acupuncture, women do tend to have a reduction in hot flash symptoms, and sometimes it can benefit sleep as well. There's some studies that show that. In my experience, I think there are women who really do benefit from acupuncture. And I think with all these alternative remedies, some women really benefit and some women really don't. It's not that somebody's going to get, 20% benefit. It's that people either benefit or they don't. And that's why we see sort of mixed results in studies.
Seems pretty black and white.
Yeah. And so, I think acupuncture is a low harm intervention. We have great acupuncturists in the Pacific Northwest as well as all over the country. And I think, it's certainly worth a trial if that's something that you think might benefit you.
Well, I want to try all the things because it can feel like you are going absolutely nuts and crawling out of your skin. And I am so thankful for you and the team at Gennev because honestly, from a female perspective, for me, I have gone through this and been like, why don't we talk about this? Why aren't our doctors that I think I feel a little bit angry about it.
Yeah.
To be honest.
And I think some of it's our medical system. We as physicians aren't given the time to educate people on their bodies, right?
Yeah, you're in and out.
There's no code. There's no code for that. I can't bill you for education for the most part. And it's the way our system is structured. It's not right. But absolutely. Yeah, it's one of the reasons I got into my work at Gennev. I have a great practice at Swedish. It's fantastic. Every woman I see, I educate. It's great. But to reach more women and really get the word out that this is a normal and natural process, but that you don't have to suffer through it is really why I started working with Gennev.
Yeah, well, I certainly appreciate being the recipient of this education. It really has helped me. And I am so grateful for your willingness to come on, because I know that people listening to this will relate and hopefully get help if they are feeling any of these symptoms, because it can be extremely lonely. Like I said, these conversations are stigmatized still, and we're not talking about our bodies with each other, and that's okay. But there has to be a way to get education out there. So I will just gratuitously talk about my own experience if it helps somebody else find
but
their
that's what
way
we need
to a
to
doctor.
do, and I talk about my own experience for menopause. I've put it out there on the internet in terms of like writing pieces on it, simply because I think women need to hear that it's normal and it can happen in multiple different ways, and that's okay.
Yeah. I think that's the thing, is that it's all okay. It's all normal. This is biology. And if you need help, it is available to you.
Exactly.
Well, I know your time is precious, and I appreciate what you've given me today. I will link Gennev up to my show notes. I think we should point out too that it is all telehealth. So wherever you are in the world, Gennev is available to you.
Yes, I am going to qualify that. Wherever you are in the world, all of our information is available to you. We can only do medical care, so actual medicine, in the United States.
Okay.
We can do it in all 50 states.
And then is that true for all of your team? Are the coaching services available globally?
Yes, right now the coaching services are limited to the United States as well, because different countries have different rules about those things. But it doesn't mean there's not something for you if you're living in Canada or the UK or, wherever you are living. There's definitely information there for you, because we have years and years of podcasts and webinars and blogs and written pieces that you can really benefit from.
It is a phenomenal resource for women and a great starting place if you have any questions about where you're at in your own phase of life. But more importantly, it is a valid phase of life. And I think something that you said really resonated with me, where we want to experience the second half of our lives being able to benefit from all the education we have, hitting our stride, at 45, 50, and not being debilitated by these things that are kind of out of your control. So for me, I feel way more empowered just having spoken to you about it and saying, okay, this is something I can really get a handle on, and I'm not going to be afraid to do that, because that is what this is.
Yeah, and I reassure women with a couple of different things. I say, there is no glory or valor in struggling through menopause. You don't get a badge at the end if you made it without hormones. You need to do what makes your life livable and beneficial.
It's like all things, isn't it? Like there's no badge if you do a natural childbirth versus,
there's no ribbon. Nobody gets a ribbon.
You just get to talk about it at parties.
Yeah. The other thing I say is that, you need to reframe the menopause. The ovaries are one of our major endocrine systems. So we have many endocrine systems. We have the adrenals, which do cortisol and some of the similar ovarian hormones. We have our thyroid. If one of those other endocrine systems fails, we replace it. That's considered normal. However, women are expected to take the failure of their major endocrine system and just go with it and suck it up. So just think about it that way. You have 30, 40 more years to live. Why would you just struggle through the failure of one of your major endocrine systems?
Those words actually just kind of blew my mind a little bit. I mean, that is so true. They are major systems for us. And whenever anything else goes down, you would absolutely.
Yeah. And granted, you're not going to die of menopause. But it can be pretty rough for many, many women. And it doesn't have to be.
Well, that is inspiration that I am taking away from this. And I just really appreciate the validation and giving support to women out there that are going through this. So as we start off 2021, Let's start it off empowered and not afraid to take this on and to talk to our medical providers about it, whoever those people may be.
Absolutely. And like I've said, it doesn't mean that you have to have hormone or you have to do this, that, or the other thing, but you should know what all the options are and choose the one that makes sense for you.
Words to live by.
Fear.
Well, thank you so much, Dr. Dunsmoor-Su. Mm-hmm. I cannot thank you enough. I think this will help a lot of people. It certainly has helped me. And so I am forever grateful.
Well, I'm glad to have done it.
Ladies, if you take nothing else away from this episode, my hope is that you realize what we all go through is completely normal, and most importantly, there is a way to make it bearable. We should not have to suffer through symptoms because we don't realize what's happening. There is help available, so please use it. Gennev's information will be in my show notes and social media. They are available to anyone in the U.S. for medical visits and globally for information and education. This is something that's happening to us. It's right in front of our face, so let's release the stigma. On a more personal note, although I'm not sure that's possible after this episode, I'd like to say a huge thank you for supporting and listening to this podcast. There have been days this year that I've wondered if it's worth it to continue finding stories, but the response keeps telling me that it is. Thank you for your tweets, your messages, your emails. I appreciate them and they keep me going. As we go into 2021, there are days where I feel sad, unmotivated, and wondering if anything is worth the effort. Then I meet someone incredible and inspiring and find the energy to keep moving. I hope you find those people in your own life. They truly are right in front of you. Please find me on social media. I'm most active on Twitter at In Front of My Face and on Instagram at Right in Front of My Face. You can email me at rightinfrontofmyface@gmail.com. And please have a wonderful holiday season.